They do a little intro. So you'll start.
Oh, okay.
Yeah.
Early to be back. Okay. Oh, there you go. It's back. You're right, Ngozi.
Elizabeth, I didn't hear the intro.
CAHN Health Hour with Black GPs and senior consultants giving Black health advice, improving Black health equality. CAHN Health Hour.
Good morning, everybody, and welcome to our Saturday Health Hour. Delighted to see you all once again. And if you are watching us live, great. If you're listening to us while you're doing your Christmas shopping, great. And if you are watching us after you've got back and you're putting your feet up or having a cup of tea, but really want to know about Black health, even better. So thank you for joining us. Today, as you know, my name is Ngozi Ediasage. I'm a pediatrician and I work in Manchester. I'm also the medical lead for the Caribbean African Health Network. And today, I'm really, really delighted to invite Dr. Nkolika Anyabolu, who is a GP, who's going to talk to us about asthma and the flu. So as usual, please put your questions in the chat and let us know what the questions that you have concerns about. If you want to, you don't want to be public about your questions, you can put them into a private chat to me and I'll ask them on your behalf. But without much further ado, I'm just going to hand over to Nkolika. Thank you.
Perfect. Thank you, Ngozi. I'm not sure if you can still see my screen. Can you see my screen?
Yes, we can. We can see you. We can't see your screen. So maybe I'll just share the screen.
Yeah. So I'm just gonna share my screen again because it was shared before. Can you see it now?
Well, in full, I think it's coming. It sounds as if it's coming, but it's not there yet. It's got, yeah, here we are.
Perfect.
Thank you.
Hello, everybody, and thank you, Ngozi, and thank you to the CAHN team for inviting me here today. Like Ngozi said, I'm a GP. I'm based in Dorset, and I've been asked to give you a talk on flu and asthma. So just a little bit of a background as to who I am. Like I said, I'm a GP. I'm also an artist and I like to paint, and it's a way for me to cope with obviously the pandemic and the stress and just generally maintaining my well-being. I'm also a primary care fellow for the Health Education England, the Wessex Deanery, and I'm also part of the BAME Health Collaborative charity, again, looking into how we can improve the lives of people from ethnic minority communities. So without further ado, let's go into asthma. Obviously, this session is not it's not a session on going into the nitty-gritty of what asthma is. It's basically an awareness session, and I hope that you're going to take away from this session a basic understanding of what asthma and flu is and why it's important to be aware of what they are, their symptoms, how they're managed, and what you could do to help yourself and to help the members of your family and the members of the wider community. So asthma is a chronic respiratory condition, and it causes an inflammation of the airways and makes the airways very highly responsive to little triggers. It's a very common condition, and according to the British Lung Foundation, there are about 5.4 million people in the UK who are currently receiving treatment for asthma. So it's incredibly common. This slide just literally breaks it down and tries to explain the pathophysiology, the mechanism of the disease. So if you look on the blue side, it shows you what the healthy lung is like. You know, you've got the smooth muscles that are very relaxed, and you've got the airway, which is very patent and open. Then look at the the picture on the right, and it represents that of an asthmatic. You could see that the muscles are so contracted, and in the airway is filled with a lot of mucus and a lot of gunk, and the airway is so narrowed, and that is why lots of people who have asthma present with the symptoms they do, and that is why asthma is such a deadly illness, in as much as it's so common. Unfortunately, it's still causing a lot of morbidity around the world and in the UK. So what are the symptoms? You know, a diagnosis of asthma should always be suspected in anyone who has a wheeze. A wheeze is simply a whistling sound. When someone is breathing, it's almost like as if they are whistling. And breathlessness, when people are just you know, difficulty talking, they're constantly breathless. And some people describe it as having that tightness in the chest. They just can't breathe, they can't get air in. And obviously cough. And again, it should be suspected in anyone with a history of allergy in their family or in themselves. And as doctors, when we listen to the lungs, we hear lots of widespread, it's called widespread wheeze. Again, the whistling sound, you hear it everywhere around in the lungs. The triggers, what are those things that can trigger an asthma episode? It's very common when people exercise. You know, they get the tightness, the cough, and the difficulty breathing, often triggered by exercise, or allergens, or exposure to whatever it is that their body just does not happy with. Then again, changes in weather is worse in cold weather. It's almost always, as a GP, we come across lots of people who their asthma flares up as the winter draws in. Then we've got viral respiratory infections. These again are viral infections which are not very good for people who have asthma, because it can trigger a flare-up of the asthma. Then the last trigger obviously is medications, which are very common. I put non-steroidal anti-inflammatories because the commonest that you can get over the counter in any shop is ibuprofen. So that's a common medication that lots of people use for pains in the bones or even pain anywhere. So it's important to remember that these medications in this class can trigger asthma and give you that cough, chest tightness. So risk factors, what are the risk factors? You know, there are certain things, there are certain factors that if one is in contact with or that one has, that can increase their risk of developing asthma or even having asthma. And it's all listed there. And obviously, if you have a family history of asthma, you're more likely to develop asthma. And obviously, exposure to tobacco smoke and premature birth or low birth weight, and obviously obesity and social deprivation. In 2012, you know, the British Lung Foundation found that the incidence rates of asthma in most deprived communities was 36% higher. And it was mainly put down to, obviously, the fact that that socially everyone is together, there's lots of smoking, there's lots of social inequities, and that oftentimes exacerbates these risk factors and makes people from such communities more at risk of developing asthma. Then obviously you've got the exposure to inhaled particulates. Later on in the session, I'm going to highlight a very sad case of this inhaled particulates and pollution, a very sad case of something that has happened recently, which I'm pretty sure many of us are aware of. Then obviously you've got workplace exposures, including floor dust and all sorts of, you know, irritants that people come across due to their work. Then complications. Obviously, asthma being as common as it is still causing a lot of morbidity, like I said earlier. And the complications can include death. And I've included a picture of Ella, again, the sad case I mentioned of a little girl who died from the complications of asthma. And it's again, there are more than 1,200 people died from asthma in 2014. And asthma causes an estimated 250,000 deaths worldwide. It is that bad, and that's why it's so important that we are aware of again, all the things we've talked about, and important to take steps to try and mitigate against that. Part of the complications are, again, respiratory complications like pneumonia and respiratory failure and pulmonary collapse. So these are all the complications that can arise. Then you have the impaired quality of life. You know, when asthma is not well controlled, where it's not well managed, people struggle with fatigue and underperformance, and lots of children need lots of time off school, and obviously that affects the way they perform later on in life. So when we talk about the management of asthma, you've got the pharmacological management, the drug management, and the non-drug management. Again, when we come to the drug management of asthma, I've included a picture from, again, from the British Lung Society, which highlights the different treatments available. It's a stepwise treatment, and it usually starts with a simple inhaler like Ventolin, that people can use up to 4 times a day to try and help with the symptoms of asthma. And as the control, if the control is not as optimal as it should be, we can go up and down this ladder depending on how the control is. But the aim of control of the management is to have complete control, where people will not have any symptoms of asthma at all, and asthma will not be interfering with the ability to live a normal life. Again, at the end, I'm going to introduce. I'm going to add lots of links and to the resources that I use, where you could go and read up a lot more about the management. Then we come to the non-pharmacological management. Again, it goes back to the triggers and the risk factors we talked about in the beginning. So about trying to lose weight, but trying to avoid the triggers, like avoiding smoking and avoiding being exposed to irritants. Then obviously exercise, trying to keep warm, and trying to obviously take steps to prevent yourself from getting infections like respiratory infections, which could obviously exacerbate or cause a flare-up of asthma. And that's the end for asthma. And I'm pretty sure Ngozi told me we're going to take questions at the end, but I'll go on to flu. So flu is an infection caused by the influenza virus, and it causes substantial morbidity and mortality. Unfortunately, lots of people still die from the flu, and it's worse in the winter months. It is very infectious and can spread very easily to other people. And again, it is highly infectious within the first 5 days of you catching it. Is spread by germs from coughs, sneezes, and can be on surfaces for up to 24 hours. The diagnosis is mainly clinical, mainly based on what someone tells us, you know, the symptoms that they have. And I've listed out the symptoms here. I've also put a line there just to highlight the fact that we are in a pandemic, a COVID pandemic. And unfortunately, COVID is caused by a virus, just like flu is caused by a virus. So they have a lot of similarities. And I've produced, I've added this here to highlight those similarities. The common symptoms that COVID-19 and flu share: the fever, the feeling of chills, cough, shortness of breath, the difficulty breathing. Lots of people feel very tired. You got sore throats, a runny, stuffy nose, muscle pains and headache. And you also have the change in smell and loss of taste, even though that is more common with COVID-19 and not necessarily flu. But the reason why I've highlighted this is, as a GP, we come across a lot of people who often always they tell me on the phone, I know it's not COVID, it's not COVID. But how can you know it's not COVID? It's so difficult to know it's not COVID. And that is why the general advice is, if you have any symptoms, any of the symptoms listed here, it's important to get a PCR test, because it's so important to exclude COVID-19. And the government guideline is order a same-day PCR test, self-isolate until the results are back, because that again helps in trying to combat the spread of COVID, and obviously the new variant, which is highly infectious. So it's important that we understand all that. So management. Generally, if you go onto the NHS Choices website, the first thing you're going to see there is that flu will get better on its own. So it generally doesn't need any treatment. As with most viral infections, it runs its course and it gets better. So the general advice is really to rest, sleep well, keep warm, take lots of paracetamol and ibuprofen. Obviously, ibuprofen if you are not asthmatic or if you don't have a family history of asthma, and because that helps to lower your temperature. Then drink plenty of water, because it's important not to be dehydrated. For those who get really ill, or those who have other health problems that will makes them unable to fight off simple viral infections, they may get very unwell and may need hospital admission or may need further treatment. So for such people, the GP or the hospital physician can prescribe an antiviral medication, which needs to be started within 48 hours. And for such people, these antiviral medications do help. But generally, the flu runs its course and gets better. I've added this slide about flu vaccination, because it is advised that we should get our flu vaccination between September and the start of November. And that's to preempt the start of the influenza season in the winter months. So each year, the influenza vaccinations are reformulated in order to try and match the likely circulating strains, okay, because it's never the same strain. And again, it's a free service. You don't have to pay for it, but obviously you need to be aware whether you're qualified to or eligible to get the flu vaccine. And again, it's for children between 2 to 15 and any adult above the age of 50, or anyone who has medical conditions and other factors that could reduce the ability to put up a fight to flu and the virus. I want to end by talking about Ella. Ella was a little girl who lived in South London, in Lewisham, and unfortunately she died in 2013, and she died because of complications arising from her asthma. And unfortunately, the last 2 years of Ella's life was punctuated by severe asthma attacks that led to collapse of her lungs, and she was admitted almost 30 times in hospital. And unfortunately, she died from acute respiratory failure. And it was just last year that the coroner put her death down to air pollution, because she lived just 25 meters from the South Circular Road in London, and there was a lot of carbon dioxide air pollution from traffic all around there. So this is a sad case that highlights the importance of being aware of asthma, importance of taking measures to try and reduce our risk factors of of ever developing asthma, and those of our families and young ones, but also to be aware that there are other things around us which could increase our risks of having asthma and having complications from it. And obviously, hopefully being aware of it will help us take steps to counteract this and to seek help when we need to. So these are the references. So hopefully it will be of some use to you, because it's all about knowing where to get information when you need to get information. And thank you for listening.
Oh, thank you very much, Nkolika.
No worries.
I know members of the CAHN team will put that either in the bulletin, and I hope we can share your slides.
Oh yes,
because that people find it helpful. So thank you so much for having a quick run through asthma and the flu.
No worries, no worries. You're welcome.
Thank you. And I think it was really interesting. It was pretty poignant, I'd say, about the story of Ella, which I found quite sad. One, because she's a little girl who has lost her life from a fearless, and that's preventable.
Yeah.
That she was living in such a high polluted area and had underlying asthma.
Yeah, and it's a shame, Ngozi, because her mum actually did say that before Ella's death, she had no clue about air pollution and what it could do to one's health. She had no idea. And again, one wonders if she knew, would it have made any difference? It may have made a difference, it may not have. But it's so important that we're aware of these things are not so little, but they can cause a huge damage to our lives and those around us.
So something like air pollution, I suppose, is if you're aware and you have the means, you can move. For many people, it would not be an option to be able to move. But what would be the things? So one of the things that we're really keen to do at these health hours is to try and educate people on how they manage their conditions a bit better, that they have a partnership with their doctors. So one is preventative, and secondly is what you can do to manage it well. So something like asthma, what are the things that you should really avoid? So people who've logged in today, who want to know, I've got asthma, it's pretty bad. What are the things that they can take, actions they can take to minimize the effect of whatever they do in society to reduce their asthma, their flare-ups?
Yeah, thank you for that, Ngozi. It's all about being health awareness, making positive, good life choices. First and foremost, don't smoke. If you smoke, try and stop smoking. There are lots of smoking cessation services are available. You can easily speak to your GP about that. If you're classed as being obese, try and lose weight, because that will go a long way to help your overall health. Then obviously exercising within normal limits and as safely as you can, because obviously exercise is well known to be a trigger. So it's important, but again, exercise is one of the health promotion strategies that we know that helps with general well-being and improving one's life expectancy and outcome. So exercise is important. Being aware of the medications that can trigger an asthma flare-up. So as an asthmatic, it's so important, it's a big no-no to walk into a shop and buy any medication you see. So it's so important that you speak to your GP, because it may contain certain things that could trigger your asthma. So it's being aware of it. And obviously with all sorts of herbal medications, that the same rule applies. You have to be extremely careful, because they may contain allergens that could trigger your asthma. Then obviously, most importantly, is to make sure that you are using your medications the way it should be used. Unfortunately, we come across lots of people who, number one, they don't understand what the inhalers are there for, and number two, they don't use it as often as the way it's prescribed. So they go through periods where they have flare-ups. So it's important to every GP surgery has asthma reviews organized yearly or 3 monthly, depending on how your asthma is controlled. So it's important that you keep those appointments, and it's important that you have your inhaler technique looked at, make sure you're using it properly. And obviously, if you have any questions, then do get in touch with your GP. Then obviously, making sure you're up to date with your vaccinations, especially the flu vaccine, because we talked about the triggers and the risk factors. Respiratory infections are so common, and they unfortunately can cause a flare-up of asthma for someone who's asthmatic. So never downplay these infections. So again, just a few things, but it's all about being aware of and again, not downplaying it. We have a lot of people who just don't understand the gravity of and the fact that asthma can kill. So unfortunately, I still come across lots of asthmatics who still smoke. They just don't get it. So it's just simple things which I hope you take away from today.
So that's a really nice long list. So there's a question here. I'm asthmatic. I don't smoke, but my partner does. Does that have any impact on me? And is it such an impact that he needs to stop smoking? And he doesn't smoke in the house.
The answer is yes, yes, yes. Yes, yes,
So
yes to all.
That's your question
to all
that came to me, and I think perhaps I think you're watching together. Maybe you're not, but partners, if you're smoking, you have an impact on your family members and your children if you smoke. So just stop, because I think it lingers on your clothes, it lingers in the car. So even if you don't smoke in the house, just try and stop for the health and well-being of the rest of your family who have asthma. I think the interesting thing we always get asked as well is things about herbal remedies. And you mentioned it, but I know I've got a question here about alternatives to normal medication. I presume that's medication that you as a GP would prescribe. And they're asking about alternatives to that and what your comments would be on using alternatives, because they don't want to take medicines.
To be honest, I would say speak to your GP. I have never prescribed or I've never advocated for alternatives, because at the end of the day, I can only we are meant to work within our area of competence. So I don't deal with alternative remedies. So I unfortunately can't comment on how effective they are. But again, one can see the non-pharmacological approach as alternatives, because if you don't want to take medications, then it's important to try and mitigate against those risk factors, those things that can, increase your chances of having a flare-up. But at the end of the day, if one has asthma, if you take all those steps to mitigate against the risk factors and the triggers, you may still come across periods where you get your flu vaccines. You may still come across periods where you get an infection and you need treatment for it. But if your asthma wasn't well controlled prior to that, it can lead to complications. So I guess the summary is please speak to your GP. And unfortunately, I can't comment on any herbal remedies.
There's another question that's come to me about boosting your immunity. So there's a question here that says that can you suggest any other way to boost the immune system for asthma?
Well, asthma, like most chronic illnesses, is really boils down to living a healthy lifestyle, making good life choices, exercising well, eating well, making sure you're not deficient in any vitamins. If anything, COVID-19 has highlighted the importance of vitamin D, and we've always known that vitamin D is important for us, but COVID kind of threw more light on the immune boosting potential of vitamin D, and it has always been the national guidelines that everybody in the UK, everybody living in the UK should be taking vitamin D supplements in the winter month. But again, we need to remember that as people with brown colored skin and lots of melanin in our skin, we absorb vitamin D from the sunshine 10 times less than a Caucasian. So that even means more that we as people from Black and ethnic minority origin should be taking vitamin D as on a daily basis, as long as you live in the UK. And vitamin D, like I said before, has been known to help to fight infections. And obviously with the pandemic, will give you a good fighting chance. So ways of boosting your immunity: make sure you're not vitamin D deficient, make sure you're eating well, make sure you're exercising well, make sure your weight is within the normal limits, and again, keep up to date with your vaccinations.
Thank you. Thanks to P. James. They've just put a question in the chat about, and I'm just going to read it out. I use a blue and pink inhaler, and I've had the flu jab once and was so ill that they haven't tried it again. They were working for the NHS at the time in an admin role. Their husband also took it and he ended up in bed each time. So he hasn't taken it for 3 years. We're both now early 60s. What can we do?
Yes, again, it's not an uncommon problem, yeah, because every flu jab is different from the one before. Because if you remember the slide where I said it's reformulated each time, and it's the fact that you had an adverse outcome with the previous one doesn't necessarily mean you're going to have an adverse outcome with the next one. I remember one of the flu jabs I had, one of the years I had it, I was actually unwell, very unwell with it. But that didn't stop me from having it the next time. And touch wood, I haven't had any problems since then. So again, everything in life is all about weighing up the risks and the benefits. You've always got to weigh up the risk and the benefits. So the risk of having a fever and being in bed with the flu jab, you got to weigh that risk with the benefit of being able to put up a good fight to influenza and the flu virus. Because you remember what we said before, it's still killing a lot of people. And the essence of having the flu jab really is to give you a good fighting chance. So my message to you, you've got to weigh up the risks and the benefits. If you're both in your 60s, it means you're getting into that age group where you're deemed to be more at risk of having a severe outcome from influenza. So.
Thank you. Yeah, I think that's an important message, that at the end of the day, the alternative is to leave yourself exposed to the flu. And if you get the flu, you have no way of knowing how that will end up. Yeah. So I take my flu jab every year, because it's just like COVID. You know, we know now that what viruses do is that they tend to try and adapt, so that it increases their survivability. That's what they are. They're a living organism and they want to make sure they survive. So if this year you had a flu jab, next year will come back slightly different, so that vaccine wasn't effective. So I've got another question here, is they're saying that why there's a direct question that says that, is it true that children cannot be diagnosed with asthma until they're 5 years old? So this is, in this particular person, they have a family history of asthma and their child is often breathless and wheezy.
I think, Ngozi, that falls perfectly into your area of expertise, doesn't it?
Yeah, I'm not sure why there's a direct question, but we do diagnose children, Lord Matt, with asthma. I mean, that little girl that we started this about, that story told, she was 9 and she'd been going in and out of hospital. So what they will do is they will treat you with the medication that helps to prevent and helps to treat. So you have the blue inhalers. So I'm not sure why you've been told that you cannot diagnose a child with asthma until they're 5.
Yeah, I do agree with Ngozi, because at the end of the day, it's like Ngozi said, Ella had issues, and if the treatment wasn't, obviously treatment wasn't as optimal as it should have been, one wonders that there was mom under the same illusion that she couldn't be diagnosed with asthma. So yes, it's we do have children with asthma, even though it's very common that they can grow out of it, but they can also have complications from asthma. So it's important that they are seen regularly by their GP and by the specialists who can manage them properly.
What they can do, Charles, I can see your question now. What they do if they diagnose. So what asthma is? It's a condition where you have reversibility of, and what I mean by that, it can change. So you have your airways that get smaller, and that's what produces the wheeze. So it may be that they're saying that, is there any underlying condition? Because you're much less likely to have that diagnosis the younger you are. They will look for things that might be causing that wheeze, but the treatments are the same. So the treatment will be to try and open up the airways. So people might be reluctant to put the label on, but the treatment is exactly the same. And also one of the things that help you to diagnose is by doing you have to blow into a spirometer. The younger you are, the less likely you are to be able to blow. That seals the diagnosis of asthma. So the treatments are the same, and you'll still be looked after by a respiratory pediatrician who has an interest in asthma, but everything's the same. It's because the main thing that helps you make that diagnosis is the ability to blow into a spirometer, so you can see before and after. But the fact that they're young, we have children in hospital who we've made that diagnosis because we've ruled everything out. So you have to rule other things out for the treatment system. They shouldn't get hung up with the label. Charles, you've got your hand up.
Yeah, so Ngozi, thanks for explaining that, because my son, we're told, oh, he needs to be older before they can do the diagnosis, but he wasn't assigned to a specialist or anything. It was just a case of the GP. So, that's why I'm keen on what do people do if they're given that information.
But if he's well, then you may not need a specialist. The thing is about being well. So you don't always have to have a specialist if the GP is managing it well. If there's a problem and you're getting repeated episodes and you're getting infections, then fine, you need to be referred to a specialist. But if your GP is managing it well, then you don't have to go to a specialist.
Yeah, the only thing, again, I'd like to add to that, because again, I mentioned in the beginning, every GP practice, or most GP practices, have asthma nurses, or nurses who have an interest in asthma, and they have asthma reviews that are done every month. And the essence of that review is to catch up with the patient or the parent to see how the symptoms of asthma are being controlled. Again, the aim of the treatment, like Ngozi said, is to be well to the point where you're not having any symptoms at all. If you're still having symptoms, then it's not well controlled. And part of that review involves going through the triggers, going through how they use their inhalers, and going through the medications that are currently being used. And remember that stepwise ladder. If they're still having symptoms, we go up on that ladder. So it doesn't necessarily need to have a specialist involved, because they already set out guidelines as to how it should be managed. But if you're not making contact with your GP practice, if you're not keeping those appointments for your asthma reviews, if you're not requesting asthma reviews, then it's going to be difficult for your GP or the practice to keep a tab on how the asthma has been controlled. So oftentimes the onus is on us to make sure that we're doing the things we need to do.
And there are times that's why they do have specialist clinics in hospitals as well, because there are times that if you are really difficult to control, you will then be referred. Yeah. And that's why they have respiratory pediatricians and respiratory physicians that look after people with these conditions as well.
Definitely.
Now, there's another question here, is it safe to have the flu jab and the vaccine at the same time or within a week of each other? That's really simple. The answer is yes, because they're offering people to do that, to sort of save time and make sure that you don't have to book another appointment to have your flu jab. And I presume when you say vaccine, it's COVID vaccine, because that's the one that people are most concerned about at the moment.
Yeah, I had mine both at the same time.
So there's another question here. Can you explain the reason why asthma can be a higher risk for of getting COVID complications?
Well, it's simple, because COVID generally can affect different parts of the body. It can affect the lungs, and asthma affects the lungs. So if you've got underlying asthma, that means that your lungs already are not as efficient as they should be. So that means that COVID, which we know can attack the lungs. If you get COVID on top of having asthma, it means that your outcome may or may invariably be worse than for someone who doesn't have asthma.
And then, is there a psychosomatic aspect to asthma? Or you don't think that psychosomatic has any influence on asthma?
Every illness has a psychosomatic element to it, but when you say psychosomatic, I would imagine is more like, you know, when people get really anxious, the chest gets tight, they can't breathe, and they struggle to get air in. That's a different problem. Asthma is a structural problem. There's something structurally wrong with the tubes. There's something structurally wrong with the airways. So that's not a psychosomatic. It's not psychosomatic at all. It's a real pathology that needs to be addressed.
So I suppose that means that no more than other illnesses, that if you're stressed, you might get your blood pressure goes up. If you're stressed, you might have more difficulty in breathing, and that might affect your asthma, might trigger you, I suppose, but nothing more than that. So I hope that's answered your question, the person that's put that to me directly.
Sorry, say that again, Ngozi.
No, just commenting. Someone had asked me a direct question about the psychological aspects of having asthma.
Yeah. Again, I like to add to the fact that asthma is a chronic condition. As with all chronic diseases, there's an element of low mood and depression that goes with it, and obviously anxiety, because we know that any chronic illness comes with this mental health issues. But again, it's a very physical, structural problem, and in terms of the difficulty breathing and chest tightness that comes with panic attacks, that's not going to kill anybody. But asthma, if it's a real asthma flare-up, if it's not addressed, it's going to kill you. So it's all different.
So one of the side effects of the COVID vaccine is breathlessness. And so they're asking, what advice would you give when people are going to have their vaccine? Is it useful to have take your inhalers beforehand to try and protect yourself? What advice would you give people?
Again, it's a difficult one, because the fact that it states that you're going to get breathlessness as a side effect doesn't mean you're going to get it. It's just something to be aware of. And obviously you've got your inhaler at hand. So if it happens, take your inhaler. But again, the breathlessness may not necessarily be due to the narrowing of the airways, because even people who don't have asthma get breathless. So there are different causes for breathlessness. It's something we need to be aware of. So your inhaler can only work if the breathlessness is caused by a narrowing of the tubes. That's what the inhaler is there for, to open up the tubes. Or if your breathlessness is not caused by the narrowing of the tubes, it's not going to work if you take the inhaler. So again, it's about being aware of the side effects of the vaccine. Go have your vaccine. If you develop any of those side effects, get in touch with your GP, and they will help you to deal with, or 111 if your GP is closed.
Okay, thank you. As I said at the beginning, I knew that since we're talking about chests and airways and flu, that we'd have a number of questions about COVID. I'd just like to say, a rider, that we're not COVID experts. We're both doctors who work in the NHS, and of course have some understanding, and also cannot fail to be involved because of what's happening at the moment. And so there's a question that's come to me about concerns that they work for the NHS. They're concerned that they're going to be mandated to have the vaccine, and they've got asthma. And the last time when they had the vaccine, they really didn't feel very well. So they're not keen on having the booster. And they feel now that they're in a bit of a quandary because they're going to have to take it, or else leave a job that they really love. Any advice?
So what I would say is that the only the contraindication to having the COVID jab or the booster is a previous anaphylactic reaction to a COVID vaccine. So being unwell with the COVID after you've had a COVID vaccine, unfortunately, does not exclude you from having the booster jab. Again, it goes back to what we talked about in the beginning. It's always going to be the balance of the risks and the benefits. What is the essence of having the booster jab? And if you work for the NHS, it means you're more at risk. And obviously, if you've got asthma, that means you're even more, twice, 3 times, 4 times, 5 times more at risk of having severe outcome from COVID-19. So the booster is there to help boost the immunity. But obviously, you had you felt unwell with the previous jabs that you had. That unfortunately does not mean you cannot have the booster jab. But again, I would say, like I've always said, and I always tell people, please speak to your GP, because every decision has to be individualized based on your own personal circumstances and your own medical history and medical records. So I would say speak to your GP.
So the other thing I'd say when people have asked me this directly, the other thing I always like to add is that if what the jab is doing is trying to boost your immunity. So it's really common to feel unwell. And you felt a little bit unwell with a little bit of the virus, because that's what it does in a sense. So you think that with your underlying risk, if you had got the disease itself, how you may feel, it means that perhaps it would be much worse for you. Yeah. And for me, the fact that you felt unwell is not enough a reason not to have your booster jabs. In fact, I say to you, it's actually more important that you go and have your jabs, or first and second, and your booster. What we know now, because I think COVID has interspersed almost all our weekly talks. And so it's no surprise that we're talking about it again today. What we now know, which is different to what we knew a year ago, is that there's been so many doses that have been given that we now have evidence that it's safe in the short term. Because I know people will say, well, you don't know what the long-term effects are. Yeah, nobody does. But we know in the short term, it protects you from death. So we can see the figures, and everybody's seeing the figures every day, that if you have your jabs, it protects you from dying. And there can be nothing more powerful than that. Yeah. Because at the end of the day, all these talks that we give, all the questions that you ask us, is because you want your outcomes to be better. You want to live a healthy life. So please, we always try and have a plug for having your jabs. So there's a question here about why most children in this country suffer from asthma. I don't know if that is, you can say why a lot of children, but it's definitely not most. And it could be that you have come across quite a number of people that do, but as a pediatrician, I come across quite a lot of children, and it's definitely not most, but it is a lot. So I'm going to hand that back to our GP to talk about why a lot of children.
It's interesting because if you remember back in the slide, we talked about the risk factors, and there's a family history of allergy, a family history of atopy. So again, remembering that, one wonders, because our foods are so highly processed now, and we're living in climate change. There's a lot of pollution. There's a lot of our bodies are not able to put up a fight anymore. So one wonders, it's a multifactorial thing. It's not just one thing that's leading to the increase in rise of asthma. So it's several things that come into play, and it's important to try and piece that out. I don't know what Ngozi has to say about this, but again, some people have put it down to the fact that there's a lot of formula milk, formula feeding for babies. Not a lot of babies are now being breastfed, because in the breast milk, you get lots of antibodies that helps to put up a fight and makes babies more able to put up a fight to allergens. But because lots of people are choosing not to breastfeed, lots of babies are not having that ability to put up that fight. I don't know what Ngozi has to say, but it's one thing that we've also noticed. But my point is, it's a multifactorial problem. It's not just one thing. There's several things that come into play to cause this.
So thanks for the plug with breastfeeding. We I think it's really, really important to make sure that if you can, you should breastfeed, because it does help to give you that initial immune boost from your mum, which is something that formula milk cannot give. The other thing that you mentioned, you talked about, is this question came up because of asking about children. Well, one of the comments I've had before is there are some conditions that seem to be more prevalent when you come to the UK as an immigrant. So schizophrenia is one of them. In your experience, is asthma one of these things, that there's a lower incidence in parts of the Caribbean and Africa, say Nigeria? Is there any evidence about that? So that when you come here, and I suppose logically you might think that there is. Does the cold give you more susceptibility, or is it that you had asthma but you're not exposed to any of the underlying things that cause it to flare up?
Yeah, that's
an asthma.
That's a very good question, Ngozi. Unfortunately, where I live and work is not a very diverse part of the country. So I don't come across a lot of people from Black and ethnic minority groups. But again, there is some credence to the fact that the change in climate, the change in environment, a change in exposure to pollutants, a change in access to treatment, a change to access to diagnosis. Is that why we're having more of that, or is it because lots of people are getting it more? I think again, it's not just one thing. We must understand that being in the UK means, and having access to free NHS care means that we're getting a lot of things that we may not necessarily have gotten back at home. And we obviously, the UK being one of the best healthcare systems in the world, there are regular updates, they're keeping abreast with new developments. So that means that we have this diagnosis and the treatment started early and diagnosis made very quickly. So again, it's all down to data, isn't it? So yeah. It may well not be that it's a real thing, it's just down to data.
Okay, thank you. There's another question here about the interplay between allergic rhinitis and asthma. So this is someone who's started to be diagnosed with prescribed inhaler for the rhinitis. Does that mean that they're more likely to have a diagnosis of asthma?
No, I don't think so. Rhinitis really is inflammation of the lining of the nose, and when that happens, lots of people get bunged up, and they're constantly bunged up, and it's usually worse at night, and they have to use sprays to try and open it up. Again, rhinitis can be triggered by allergens. So again, it all boils down to atopy. It all boils down to allergy. It all depends on which part of the body this affects. For some people, I'm allergic to dust. I remember ever since I've been in the UK, I haven't had as bad flare-ups as I had back in Nigeria. I remember sweeping in secondary school. We're trying to get one of our halls ready for a program, and I went in there with a broom to try and sweep the whole place up and cobweb the place. Within 2 minutes of doing that, my eyes swelled up, my nose was streaming, and my chest was tight. It was just the dust. It was unbelievable. So again, it's the allergies. Once you're exposed to it. So rhinitis doesn't translate to asthma. It doesn't translate to asthma. But again, it's a reminder that you maybe have a history of allergy and atopy, and it's just something to be mindful of.
I guess it's a sort of interplay. You might have, now that we have all this, the ability to look at whole genome sequencing, who knows how near those genomes are, the ones that cause asthma, the ones that cause rhinitis, because they're all about atopy and how your body responds to factors. Someone's put in the chat about the fact that it's interesting that Black people in the US have the highest risk of asthma and are 3 times more likely to die when they get it. Now, I think that is social factors, because we know that it's linked to deprivation. So as we've talked about, if you live in an area of high pollution in inner cities, you're more likely to be exposed to the pathogens than if you live in the leafy suburbs. We also know that, unfortunately, unlike our NHS, where we have an asthma nurse, your GP, who will call you for regular updates, in America, if you're poor, you don't get regular updates because everything is linked to
insurance.
So you don't get the control that you would, and if you're not well controlled, it means that you're much more likely to have a severe asthma attack because it's not been well controlled, and if you have a severe attack, more likely to die. So I think some of there are some conditions that are absolutely more common and more prevalent in Black people, but some of it is linked to socioeconomic factors, and that cannot always be teased out when you're comparing outcomes in America and outcomes in England of the same disease, just because we've got that underlying structure. Yes, we all call out the NHS that it's creaking at the seams, especially at the moment, but it is we're really lucky to have, and both of us who work in the system know that we are lucky that you need to access your screening and also access things that help you to control your conditions. So as a recap, we're now coming up, it's 2 minutes to 12. I always like to have a take-home message for people who have want to listen. And I know that I hear people and they tell me that they find these sessions really valuable, because I think if somebody here decided, I'm going to Google asthma, you sit down, you don't have the ability to understand all the terms, especially if you're not medical, but to have that ability to listen to somebody and intervene and ask your questions and ask clarification for things that you don't understand is so much more than just reading it up on Google. So thank you so much for coming today. So I always ask that I like people to have a take-home message, really, that one thing that you want them to remember from your talk, or one of an important thing that they can take off with them. And if they're asked, what did you think about the session today? They can say, this is the one thing I took away and learned. So what's your take-home message for people who are listening, or people who will listen?
Oh, my take-home message. I would have said take-home message.
Have more than one.
My take-home message is asthma is very common. Asthma is common. Asthma is a killer. Okay, we shouldn't downplay that. And another take-home message is you've got the power to take control of the management of your asthma. The third take-home message is your GP is there and your GP is on your side. But as we know very well, for people from ethnic minority groups, we never call our GPs. You've got to pick up the phone, get in touch with your GP, make sure you have your regular asthma reviews, make sure that understand that the aim of having an asthma treatment is that you should never have symptoms. If you're still having cough, chest tightness, or any symptoms, then your asthma is not well controlled. So please get on the phone, get in touch with your GP.
Okay. Oh, just before, since they've managed to sneak in their question after, even though it's after your take-home messages. Someone said I recently had an allergy test for specific allergies. When I was younger, they tested for a broad band of allergies. Is that what they do for everyone these days? I don't think they do that for everybody, but they may do that for specific things to see if there's anything that triggers. You might want to add to that as a GP who might say.
Yeah, to be honest, atopic is such a common problem. And if we go testing everybody in the UK, it's not going to be effective. So usually testing is reserved for people who are really having very severe outcomes from their allergies, especially if someone is having an anaphylactic reaction or someone is having near anaphylactic reactions, then definitely we want to know what that allergen is. Or for someone who our regular treatments is not working for, then we are refer them to an allergy expert, and that's where they conduct tests. But you need to bear in mind that there are so many allergens, so many. So there's no way one can test for everything under the face of the earth. So it's about having a specific target.
There's a question from YouTube. What's the best treatment for non-allergic rhinitis?
The best treatment for non-allergic rhinitis? Again, all simple antihistamines that you can buy over the counter. Speak to your pharmacist or speak to your GP. There's so many treatments. There's no one best treatment, because at the end of the day, what works for me may not work for Ngozi, and it may not work for Charles. So it's about finding what works for you. But lots of people do end up using antihistamines or steroid sprays. Again, you can get that over the counter or speak to your pharmacist, your GP.
Thank you. Okay, that's fab. I always have a take-home message as well, and I'm pleased that you've all listened. And if you do have asthma and you haven't had your jabs, please do. It's really important to have your COVID jabs and your flu jab as well. During the week, we were really fortunate to have the Director of Health Inequalities on a session with us that we'd arranged because of the concern about the new variant, Omicron variant, and how it's rising, and concerns about the COVID vaccine as well. People still have concerns. But one of the things that she said that really struck me, and the way she described why it's important for you to have it. And she gave a really good analogy of having your house and you live there and you had, it was broken into. So when they broke into it the first time, you said, well, what I need to do now is to shore up my defenses. And so the first time they came, that was your first jab. And then they go away, but you know they might come back again. So they come back, and what you do this time is that you now put in some floodlights and you put in an alarm system, and that's your second jab. But the thieves come back again slightly differently with more, now they've cut a key to your door. So what you do this time is change the locks, and that's your booster. They keep changing, the virus, as we've said, changes because it needs to try and survive. But what we're really fortunate about this time is that the booster jab that we're being given has an effect on the virus. So please get your jabs. Don't listen to the misinformation out there. Go to trusted resources to get your information, and speak to the medical professionals at the Caribbean African Health Network, because we will try and inform you about trusted sources. Don't listen to the sources that you get on your WhatsApp message. Just try and listen to trusted sources for information. So I'm going to hand over to Charles to just wrap up. But before I go, Nkolika, thank you so much for coming. I just want to make a plug as well. I had a quick look at your website, and I think one of the things that we fail to do as medics is that we don't really take time out for ourselves. But this is a medic with a difference, because she paints. So if you're interested in buying one of her paintings, just look on her website. I think it's fantastic. We've got a medic who's multi-talented.
Multi-talented. Thank you, Ngozi. Yeah, that's very kind.
So over to you, Charles.
Yeah, thanks, Dr. Ngozi. So, Dr. Nkolika, what inspired you to get into arts?
I don't know. I've always liked painting. I always liked painting. It's and in a way, I'm very glad I never gave up on it, because I was doing it while I was in school. I think is what made me. It's what makes me a whole doctor. And look at it now. We're in a pandemic, and everyone is stressed to their eyeballs. And for me, it's my painting is what makes me survive in the UK, survive in the NHS, and survive, be able to do what I'm doing. So I think in terms of why I got into it, it's just I just love it.
Yeah, and also we're very much aware of social prescribing, and even using arts as part of therapy for people with mental health. So what is your message for our community? Because I know some of us have 3-4 jobs and we're running from one thing to the other. Any tips?
Any tips? Again, just like Ngozi said, you got to make time for yourself. You got to be selfish. You got to be selfish. If anything, COVID has reminded us of the brevity of life, of the fact that it can be taken away from us anytime. And again, the fact that we need to take active steps to look after ourselves. So yes, it's an incredibly stressful time, and often being Black and ethnic minority is even more stressful. So you've got to make time to develop a hobby. Lots of people tell me, "Oh, you're very good at what you do." I don't have any hobby. No, you've got a hobby, you've got a talent. You just got to discover what it is, and find whatever helps you to distress. Go for it, because like you mentioned, Charles, social prescribing is a big thing now, because we now know there's a lot that we can't do with medicine. So it's about this social being aware of the importance of looking after yourself. So you're given permission, all of you, you're given permission to look after yourself, because oftentimes we need that permission, don't we?
Great, thanks for that. I'm hoping that the first Saturday of 2022, the second Saturday, the first session of the health hour, we'll be looking at certain health goals for 2022. Yeah. Dr. Ngozi, week after week, you've been hosting, the health hour. What do you do? I mean, what is your hobby? Because I remember you put me to shame during the vaccine clinic back in April when, your Apple Watch had all your steps and stuff. But, what have you been doing to keep healthy?
Well, I like things like the Apple Watch help me because I like having goals. So I like to have to get my steps in and do a bit of walking. And when I walk, I think. So it's my me time because it's just me. Or I listen to podcasts if I run. And it's a time that is just me, and you can really just be by yourself in your own sort of bubble.
And I remember you talking about, when you're watching your movies, you do it on the treadmill.
I do, so I can multitask.
Right. So I think it will be amazing that the first session we have next year, have a couple of you and, practical steps about setting goals for 2022. So I'm sure, Dr. Nkolika, you've done some virtual art painting and stuff. So we need to have you on a session where, for some of us who could never draw in school, we get some tips.
Yeah, no worries.
Great. Yeah, so just to say massive thanks to everyone. It has been an incredible 2021. Your support has been amazing. Health hour. I remember the middle of January where we had, 18 plus of our doctors and, 1,000 on Zoom, 800 across YouTube, Facebook. And, a week before Christmas, we're still going. And we have been called upon to support with the vaccines uptake. And like Dr. Ngozi mentioned, we will be pushing, we will be engaging. We have the helpline and we'll make ourselves available. 2022-23 will be an exciting time because lots planned for health hour. We're going to try and take it to the next level. And we will be meeting with Dr. Ngozi, Dr. Nkolika, and other partners, as well as Dr. Vanessa Pierre. We've had some investment from the National Lottery, so we will be announcing that. But really coming up with a package that will begin to shift the dial. And thankfully, we have 2 partner organizations in London, 1 in Leeds, Birmingham, and Sheffield that will be supporting as well. So exciting times 2022-23, and we look forward to working with you. So just to say, yes, our helpline is available during Christmas. We know it's a time of celebration, but there will be people who may need some help. So, our helpline will be open. We also have our trained counselors who will be available. It might just be that someone wants to talk to someone. I mean, some of the challenges and the advocacy stuff we've had to deal with recently is quite striking. But yes, we're still in difficult times, and we're encouraging people to look after themselves. If you've not had any of your jab at all and you want to speak to a Black medical professional, the doctors we have, then please get in touch and we will put you in touch with one. And I think the unique thing about these health hours are all the doctors that make themselves available and come on it and present. They're happy to have one-to-one free consultations. So we're incredibly grateful to all of them and the difference they've made in our community. So massive thanks, everyone. Look after yourselves. Have a wonderful time. Try and unwind, recharge, over Christmas, New Year. And we'll see you on the 8th of January. Massive thanks.
Bye-bye.
Bye, everyone.
Giving Black Health advice. Get informed today to have a better, healthy tomorrow.